Hi again, this is Jim Rush, and I'm doing another YouTube presentation. Um, uh, this time it's going to be on establishing Federal Reserve inventories of medical material, and I also call this bolstering America's healthcare supply chain during future spikes in demand. And the purpose I'm doing this video and others is to share with you my wonderful experiences as a materials manager and as a theater reserve or Federal Reserve inventory manager. And I'd like to thank all the people who were good to me and helped me along the way, and I'd like to be able to pay this forward. I believe my experience in managing Federal Reserve inventories may form the basis of the only way that I can see to avoid future healthcare supply chain disruptions. If you like this presentation, please press subscribe, and then you'll see all the other presentations I think you might like. I hope that it will help. Anyway, the current situation is we are in the middle of a supply disruption that doesn't seem to have an end. There's reasons for that, and I discussed that in other videos, but basically when you get into a culture of scarcity, bad things happen to good supply chains, and I think that's a majority of what's been going on. And you see that in a microcosm at your retail big box stores and things. You know, we use Sam's up the road here in Temple, Texas, and there was almost nothing on the shelf in terms of durable supply items, and then all of a sudden it comes in and it goes away. And I lived that in the Republic of Turkey, where we were always out of something and almost never had a day where you could bank on getting the supplies that you wanted in terms of the commissary and the BX. But also, my supplies most of them came through the port of Eskindrum, and that was the end of the supply chain world for the Defense Department. So there was very few times where I had any certainty of what I ordered was going to come in that loading dock. But also, you know, the pandemics provided us, I think, with a glimpse of the future of large-scale disasters and the effects it will have on our supply chain. I worry now if one more serious event could do us multi-decade damage to our healthcare supply chain. And then for years we've been living with and trying to live through medical product shortages via the Federal Drug Administration drug shortage list. That item list always should have had a goal of being eliminated, because we have pharmacists all over the country and healthcare providers all over the country who every day are doing workarounds on the phone. Now those workarounds, I couldn't find any scholarly report that went into how many billions of dollars in lost hours our pharmacists have experienced and our healthcare providers, but it's got to be astronomical, because we are a big system. We're going to talk more about that. Everything America does is big when it comes to supply chain. So what is the solution to the disruptions we're going through? And for the federal FDA drug shortage list, the solution is going back to the future. And what's amazing here is we've done this before. We've fixed this before. There is two different occasions where America bolstered supply chains in a way that we could, if we use those models now, we can do this, and we can do this pretty fast. The first one was basically the 1973-1974 oil embargo. We remember, those of us who are ancient, I'll speak for myself, but remember the gas shortages wrapping around blocks, city blocks, and you can see that on the internet today. So the oil embargo energy crisis was one case where we solved that problem. or for the most part. And then number two, the 50s and 60s, the Department of Defense built a medical logistics program that we could purchase inventory, store it at depots here in America and elsewhere, and also, portions of that major inventory we could store in Germany or in Japan or in Korea. So, okay, so back to the first one, oil shortages. Starting in October '73, an OPEC oil embargo led to long lines and outages, gasoline lines all across America. In 1975, the federal government stood up with the Department of Energy a strategic petroleum reserve. Today, that strategic petroleum reserve includes about 710 million barrels of crude oil. Now that's a lot, 710 million barrels of crude. Now, that sounds impressive, but we use about 20 million barrels per day. So depending on how cut off we are in the future of oil, that could go anywhere between just 1 month, just over 60, I think it's 63 days, if all the oil coming into the country was shut off, and going out to around 3-4 months, depending on the number of suppliers that we can still depend on. So that's not a long time. That's not like 2 years supply or anything. It's in a range of months. Whenever there was, we did have strategic petroleum reserve releases by the president a few times, and over time, 230 million barrels of oil have been released and then repurchased in our history. The Strategic Petroleum Reserve also conducts test releases. I think that's to gauge their readiness to release if they had to, and to provide quality control activities, maybe stock rotation. And this is how the feds provide a just-in-case backup of our normal just-in-time oil needs. Example number 2, the Armed Forces medical supply chain. Back in the Cold War, I think we learned from World War II, we certainly learned from Korea, that hostilities could break out in a hurry, and the demand for medical products could be astounding. So the Defense Logistics Agency built a program. It's called War Reserve Materials, and they had many different classes of supply, everything from tires for vehicles. And the one I'm concerned about here is the medical war reserve material. It was multi-billion when we stood it up after Korea. Wholesale level inventories of medical supply in depots in the United States. We also took a portion of those inventories and pre-positioned them, one in Germany and another one in Korea. So those were pre-positioned war reserve material on the continents of Europe and in Asia. Federal Reserve inventories were designed to support the onset of a medical wartime activities. So how did that medical reserve program work? And this is how our system could work. We were required, this back when I came on board with 74, we were required to purchase the majority of our medical product needs from the Defense Logistics Agency and the reserves of inventory they held, both one large depot system in the West Coast, one in the East. This basically did a few things. It reduced the Armed Forces hospitals' inventory requirements because we had certainty of supply for our items that we called standard stock items. So those of you who are in the service, in the medics, in any capacity, probably remember standard stock items. And those were the ones that the Defense Logistics Agency determined that we could need very, very large quantities of if hostilities broke out on either the European or the Pacific theater of operations. It achieved a lot of cost savings in that we had the benefit of just-in-time, or relatively, it was back in the old days, so it wasn't anything like we have here today. You order something from Amazon and it's here in a day or two. Well, that wasn't the case, but we didn't have to stock up, so we did get some of the benefits of you order basically today what you used last week, we'll say. So it was a glimpse into just-in-time, and it reduced the impact on the civilian healthcare supply chains. When there was if there were an event like 1991 Gulf War we proved it then that it worked. It was drastically downsized, however, in the 1990s. It's part of a peace dividend. We no longer have that inventory that was in the billions to back up our civilian supply chain, and you can tell that very easily. It's a shame. We have no significant war reserve materials or contingency reserve materials, whatever we call it. We have no significant stocks to back us up should there be another major disaster, then we're in a world of hurt. So what do? The current supply chain challenges that we're living with today beg for a solution, and I think that solution is where the government-owned medical materials can back up medical supplies, pharmaceuticals, equipment, vaccines, and biologics in the American healthcare supply chain. This would be able, basically, the just-in-case inventory would be run by government-owned, contractor-operated vendor. And it would be modeled after the Strategic Petroleum Reserve and the former DLA War Reserve Materials programs. The government would own the Federal Reserve inventories. Again, we'll call them just in case. And the private distributors would manage their own inventory along with the federal-owned inventories, very similarly to the way a bank manages all of our different accounts. You don't have to worry about somebody withdrawing money from your account. Likewise, the medical distributors that are around the country, the national distributors, possibly regional distributors, would be managing a portion of this Federal Reserve inventories. And as far as how do you move product out and how do you replenish it, there's the Federal Accounting Standards Advisory Board would be the one I would choose to see about how we could fashion a Federal Reserve inventory where we could move products and money back and forth between the government sector and the private sector. Just as a short tidbit, anything that is in the interest of the people of the United States of America, we can do. And we've proven that over and over and over again. So don't anybody tell you that you can't move money or assets between the federal government and distributors. Just not true. Some of the benefits that we would derive from a Federal Reserve inventory. I don't think there's any question it would save lives, reduce suffering resulting from future large-scale disasters nationally and internationally. If we had the Federal Reserve inventories right now, we would be shipping a lot to Haiti, even now, and certainly right in the very beginning of that earthquake. I feel sorry for the poor souls who are injured over there, all the orthopedic injuries, and only God knows what other ones that these poor souls are encountering. We would also be able to support other disasters internationally, humanitarian relief, as well as have constantly fresh and maintained medical material for use in a disaster in our own country. It would also provide a continuous supply of of medical needs to healthcare organizations during interruptions in either raw material, manufacturing, or transportation that we're going through right now. So that the Federal Reserve inventories, and again back to my old experience, the War Reserve material inventories saw us through a number of disaster or interruptions in the supply chain. But anyway, it will do the same for all healthcare providers in the future if this is adopted. Hopefully it will be able to either reduce or eliminate the FDA drug shortage list. The Federal Reserve inventory will reserve, and this is important, it will restore trust in the supply chain. And what that does is that allows hospitals to return to just in time much quicker than it would return if there was no help on the horizon. If we just keep going the way we're going right now, from one surge to another surge, God forbid another disaster unrelated to these surges, then we could be in very serious trouble. The answer is going to be, when you need stocks in huge quantities, you either have reserves or you don't. And nobody else is going to stock them for us. So I hope that if this presentation, as unpolished as I am, and I very freely admit that, is heartfelt, and I hope that if you know anybody who's struggling with how we're going to be able to provide imagery, believe me when I tell you, it's not stocking up at hospitals. It's not stocking up regionally. The only way you do this is you stock it with federally owned material and let our distributors, which are the best in the world, let them manage it. And they can manage their own inventory as well as the federal inventory without breaking a sweat. You just got to let them know what you want them to do. I hope this helps. If you like it, please push the subscribe button, and that'll take you to all the other presentations that you might be willing to put yourself through. Thanks a lot.
Let's make sure we got to